COVID-19 pandemic still at the forefront of our minds, many people, especially older adults, have concerns about going in for a doctor's visit or other health issues that pop up. Joining us now to discuss how telehealth is keeping patients connected with their physicians is Dr. Sarabha Bhatnagar, who is the Chief Medical Officer and Head of Technology and Performance at the UnitedHealthcare Medicare and Retirement. Good morning to you, Doctor.
Good morning. Thank you so much for having me.
Thanks for joining us. You know, I think it's true that a lot of people are nervous about going in, but it's important to stay connected. So let's talk about what telehealth is and really how it's keeping patients more connected with their doctors during a time that they're a little nervous.
Telehealth is an easy-to-use technology, and it uses both audio and video to connect you to your doctor. And it uses the technology that most of us have available to us, such as your smartphone or tablet or computer. Technology that during this COVID-19 pandemic and social distancing, you likely are already using to connect to your loved ones and family members. Using that same tools, you can connect now to your doctor's office in an easy-to-use way. And it's very convenient because you can do it from your own home or from the comfort of any location.
I think it's great. I do think it's very simple, but I think about older adults, including even my mom, and I wonder, are older adults using it as easily? Are they engaging with it? What are the barriers that you're seeing?
What we've seen is a shift in how people are accessing telehealth and accessing healthcare in general during this time of COVID-19, especially among older Americans. And so at UnitedHealthcare in our Medicare and retirement plans, what we've seen is last year, 0.1% were using telehealth. In the last month, we've seen over 12% of Medicare members at UnitedHealthcare using telehealth to access and connect with their doctors. So while new to you technology can often be intimidating, we've seen that a lot of older Americans are already on smartphones, and 88% of those across the US are using those devices daily. So my parents included are often on those technologies to connect with us and to connect with other family members via those same technologies. And it's just a little bit more work to get used to using it to connect with your provider. But I would say it's easy to do. And once you've done it the first time, I've found that the older patients that I see in my telehealth practice love the technology.
Yeah, I would agree. And when should someone use telehealth? Is there a specific time that it's sort of the best option? And when they do that, what should they know or be prepared for?
Telehealth is great for follow-up care. We've seen that over 70% of older Americans use telehealth to go see a provider that they already have a relationship with, and they've already used to being seen in the office with that same provider. So it's great for non-emergent cases such as seasonal allergies or pink eye or rashes or behavioral health conditions. I myself have seen older Americans come to my telehealth practice with headaches, for example. What it's not very good for is any emergency situations such as chest pain or burns, anything that really requires that hands-on physical examination or an annual wellness visit or any vaccinations. That's where I'd really encourage your viewers to talk to their provider about when telehealth may be right for them.
Yeah, I think that's a good distinction between the times that, it works well and other times that you really need to be in person that can't be replaced. As we kind of look forward, do you think that this is going to be a long-term trend? I think so many businesses and people, we've learned to adapt and adjust and change. And I wonder how much this will stay moving forward in the future.
I believe telehealth is here to stay. And one of the main reasons is I've been using telehealth with my patients for over the last 3 years, so well before COVID-19. And I've found that my patients love the ease and convenience to be able to see me as their provider and that easy access to their doctor's office. So I absolutely believe telehealth is here to stay. And while we at UnitedHealthcare don't think it's going to be maybe at the high levels that we've seen over the last couple of months, we do know as more people get onto telehealth for the first time, they're just going to love how easy it is to use and continue to use it.
I think it's a good way to go. Thank you so much for joining us today, Doctor.
Thank you for having me.
We appreciate it. Here's some more information so you can learn more at telehealthuhc.com.